Ancient Egyptian medicine is a term that alludes to the medication utilized in Old Egypt from the 33rd century BC until the Persian intrusion of Egypt in 525 BC. This medication was exceptionally cutting-edge around then, and included straightforward surgeries, fixing bone breaks, and planning numerous prescriptions. Albeit Old Egyptian medication is related in present-day culture with sorcery and spells, clinical exploration has demonstrated its viability by and large, and the arrangements of antiquated Egyptian meds are 37% steady with realized syntheses as per the English Pharmacopoeia gave in 1973. Old Egyptian clinical texts determined explicit strides for assessment, determination, and treatment that were frequently legitimate and fitting. The information on the early Egyptians about the construction of the human body was because of their preservation of the dead to save the collections of their proprietors. The Egyptian specialist was regarded among the Egyptians, yet additionally in the nations encompassing Egypt. Antiquated Egyptian original copies notice that one of the great clerics, Imhotep, is viewed as the organizer behind medication in Old Egypt. He is likewise accepted to have designed hieroglyphic composition, which drove the antiquated Egyptians to love him in the late Pharaonic period as the Lord of Mending. In the Ptolemaic period, the faction of Imhotep emerged, and his followers should be visible in numerous sanctuaries. The wiped out went to these sanctuaries and holy corners, looking for mending, and the Greeks imitated him and the supposed Asclepius. In Alexandria in the Ptolemaic period, the study of medication arrived at its pinnacle. Alexandria was a focal point of science, culture, and medication in the Ptolemaic time and was a school for educating specialists. It significantly impacted the clinical sciences and strategies for treatment in Greece and subsequently medication in Europe. The antiquated library of Alexandria contained compositions on medication, which were all lost during the well-known fire of Alexandria. Until the 19th 100 years, the fundamental wellsprings of data about Old Egyptian medication were compositions from late relic. The Greek antiquarian Herodotus visited Egypt around 440 BC and expounded widely on his perceptions of their clinical practices. Pliny the Senior likewise expounded emphatically on them in a verifiable survey. Hippocrates, the dad of medication, Herophilus, Erasistratus, and later Galen learned at the sanctuary of Amenhotep, and recognized the commitment of antiquated Egyptian medication to Greek medication. In 1822, the interpretation of the Rosetta Stone at long last permitted the interpretation of Old Egyptian hieroglyphic engravings and papyri, remembering numerous for clinical issues, the Egyptian clinical papyri. The subsequent interest in Egyptology in the 19th century prompted the revelation of a few huge scope assortments of old clinical records, including the Ebers Papyrus, the Edwin Smith Papyrus, the Hearst Papyrus, the London Clinical Papyrus, and others tracing all the way back to 2900 BC. The Edwin Smith Papyrus is a reading material on medical procedure, itemizing physical perceptions and the assessment, conclusion, therapy, and forecast of numerous sicknesses. It was most likely composed around 1600 BC, however is viewed as a duplicate of a few prior texts. The clinical data contained in that traces all the way back to before 3000 BC. It is hence viewed as an educating manual. Medicines comprised of treatments produced using creature, vegetable, natural product, or mineral substances. There is proof that oral medical procedure was proceeded as soon as the fourth administration, 2900 to 2750 BC. The Ebers Papyrus, circa 1550 BC, contains 877 solutions, as ordered by a cutting-edge supervisor, for various sicknesses, some of which incorporate mysterious fixes, as Egyptian convictions with respect to enchantment and medication were frequently entwined. It additionally contains archives uncovering consciousness of cancers, alongside directions for growth expulsion. The Kahan Papyrus manages ladies' objections, incorporating issues with pregnancy. 34 point-by-point instances of analysis and treatment have made due, some of them fragmentary. It dates to 1800 BC, and is the most seasoned clinical text of any sort. Different reports, like the Hearst Papyrus, 1450 BC, and the Berlin Papyrus, 1200 BC, additionally give significant data about Old Egyptian medication. Extra data comes from the pictures that frequently embellish the walls of Egyptian burial chambers and the interpretation of the engravings that go with them. Propels and current clinical innovation have likewise added to the comprehension of old Egyptian medication. Paleopathologists have had the option to utilize X-beams and later CT sweeps to see the bones and organs of mummies. Electron magnifying lens, mass spectrometry, and different scientific procedures have additionally permitted researchers to acquire novel experiences into the condition of well-being in Egypt a long time back. There are 13 old Egyptian papyrus compositions managing medication, and an enormous number of stone and ceramics parts have been tracked down that arrangement with clinical subjects. They contain itemized portrayals. The Kahan papyrus composition was found in Kahan in 1888-89 and was found by the English paleologist William Flinders Petrie during his unearthings at the city of laborers Kahan close to Lahan in the Fayum Desert Garden. Francis Griffith made an interpretation of it into English and distributed pieces of it. The original copies are in the Petrie Gallery of Egyptian Antiquarianism at College School, London. It is now and again called the Kahan Papyrus by clinical history specialists. In this way, both the Medicine Papyrus Kahan Papyrus 6.1 and the Veterinar Papyrus Kahan Papyrus LV.2 have a place with the total Kahan Papyrus. It comprises of little papyrus pieces bearing antiquated Egyptian compositions on human and veterinary medication and various drawings and estimations, and seems to have been cut after they were composed. The Kahan papyrus dates to around 1850 BC. One of the papyrus original copies contains a solution for ladies' infections, alongside techniques for treating creatures. This shocked old Egyptologists, who had long accepted that clinical consideration was saved exclusively for conciliatory creatures, which were butchered to respect a divine being. In any case, the medicine in the veterinary papyrus was for the treatment of a creature whose proprietor had looked for treatment from a specialist. Ebers Papyrus. The Ebers Papyrus is the biggest old Egyptian clinical original copy. It contains 108 segments composed on a 19-meter-long papyrus roll, and depicts countless ailments that are presently isolated into a few clinical fortes: gynecology, inside medication, dentistry, parasitology, ophthalmology, and dermatology. Different models referenced in the papyrus connect with the treatment of contaminations and cancers, the maintenance of bone cracks, and the therapy of consumes. It contains a composition on the treatment of the heart and veins, and a short segment on mental meltdown. It likewise contains various remedies for restorative medications. The Ebers Papyrus was trusted to trace all the way back to the 16th century BC, yet research has shown that it was composed significantly sooner, maybe tracing all the way back to the rule of Lord Amos, and may try and have been duplicated from more established original copies. The Edwin Smith Papyrus. The Edwin Smith Papyrus, likewise called the Book of Wounds, is a papyrus composition on medication in Old Egypt, and is viewed as perhaps of the most seasoned clinical report on treatment techniques. The papyrus vouches for the colossal advancement of medication among the antiquated Egyptians, and incorporates overall the study of life systems. The Edwin Smith Papyrus was tracked down in Thebes in 1862, and traces all the way back to the furthest limit of the 12th line in Egypt. All things considered, the items in the papyrus were duplicated from a duplicate expounded on 600 to a long time back, on the grounds that the finish of the papyrus contains a segment that is viewed as a word reference making sense of the terms, and there could be no other known model from other clinical original copies. The Hearst Papyrus. The Hearst Papyrus traces all the way back to the primary portion of the 18th line. The Hearst Papyrus contains remedies for treating intense contaminations, dental sicknesses, digestive infections, and heart illnesses. Quite a bit of this content is tracked down in the Ebers Papyrus. London Papyrus. The London Papyrus dates to the 18th administration and manages gynecological infections, cancers, consumed wounds, and visual impairment. A piece of it contains spells and mantras against infections from outside Egypt, including Asiatic illnesses. The papyrus contains numerous supernatural spells. Bruges Papyrus. The Bruges Papyrus, likewise called the Incomparable Berlin Papyrus, Additionally contains depictions of vascular sicknesses. The incomparable Berlin Papyrus dates to the 19th administration. Carlsberg Papyrus. The Carlsberg Papyrus dates to around 1200 BC and is a duplicate of a unique from the 12th tradition. The papyrus contains solutions for treating eye illnesses, signs and expectations about labor, and gynecological sicknesses. The Carlsberg Papyrus is safeguarded at the College of Copenhagen in Denmark. Brooklyn Papyri. Primary article, Brooklyn Papyri. The Brooklyn Papyri, otherwise called the Brooklyn Clinical Papyri, are clinical papyri from the late Old Realm of Egypt, and are perhaps of the most seasoned enduring composition on medication and snake science. The original copy dates to around 450 BC and is presently housed in the Brooklyn Exhibition Hall in New York. Material science. Circulatory framework. As indicated by the antiquated Egyptians, the heart was the primary organ of the body and the seat of thought. The vessels of Meta spread from the heart to all pieces of the body, providing them with air, water, and blood. The old Egyptians compared the model of the human vascular framework to the course of the Nile and its branches. Similarly, as the Nile supplies the earth with water, they imagined a comparative arrangement of vessels in the human body that provided the different organs of the body with the materials essential forever and diverted squander. An individual was viewed as solid if the interior, waterway, streamed uninterruptedly. The old Egyptians knew the contrast between a condition of well-being and a condition of sickness. He believed disease to be because of a body part not carrying out its role, which is normally joined by torment. Among the terms that the specialists in Old Egypt used to allude to torment were the articulation merit, signifying prick, and the articulation minute, languishing. We know many sorts of sicknesses referenced in clinical texts, and they are for various pieces of the body. The old Egyptians traced a large number of these sicknesses to an issue in the vascular framework and the beginning and spread of substances that cause torment. He separated between outer infections and inward sicknesses. Concerning the head, there was mind torment and cerebral pain. Treating the eyes got a lot of consideration, including visual impairment, the ear, mutism, and sicknesses of the teeth and tongue. With respect to the organs of the body, the antiquated specialist treated sclerosis, arch, aggravation, and growths. With respect to inner illnesses, he treated infections of the chest and inside organs like the lungs, liver, stomach, heart, body, digestion tracts, stool outlet, and bladder. There were additionally instances of stomach-related strain, parasites, and dying, and instances of hacking were depicted. Clinical references referenced many instances of wounds. Broken bones and wounds required the specialist was learned in a medical procedure. Treating snake nibbles, bug chomps, and consumes were ordinary things. The equivalent was valid for treating growths and diseases. For ladies, there was extraordinary treatment for the uterus and different pieces of their bodies. Youngsters were treated for hacks, hacking, and emissions. Distress, nervousness, fever, and indications of maturing were referenced as sicknesses. Beginning of infection. The beginning of infection among the old Egyptians was partitioned into two classifications: common sickness and illness coming about because of sorcery. Of the unnatural infections, they were credited to the activity of a divine being, particularly Sekhmet or devils, and the spirits of the dead. It was accepted that they beset an individual through wizardry. It was viewed as that they torment an individual through the soul of one of the divine beings or one of the evil spirits on the openings of his body on the left side. The instances of sickness were viewed as discipline for the wrongs committed by an individual, or the retribution of the soul of a dead individual, or a living individual. With respect to the instances of normal sickness, the old Egyptians credited them to an issue in the stomach-related framework. He accepted that food was not processed as expected and transforms into unsafe and difficult substances, and spreads in the body through the vessels, and may show side effects like clogging, or bulging or solidifying. An actual sickness can influence a mental disease as well as the other way around. It was trusted that, for instance, trouble and outrage influenced the heart and its circumstances, and that a problem in the processing of the stomach might prompt trepidation. Known specializations. Among the specializations that have come to us, gynecology, ophthalmology, dentistry, interior medication, and a specialty in treating harming, the doctor of the goddess Selkut, and the doctor and cleric of Heka, a title that might have been well defined for imperceptible sicknesses. Archaeologists actually differ about whether veterinary medication had an exceptional doctor. The position of the doctor was not known in all cases, but rather some portrayed him as the sovereign of doctors of the sovereign's home, or the main doctor of the Lord. Medicines utilized broadly. Perhaps of the main medicine that the antiquated Egyptian doctor composed was for treating the eyes. The overflow of sand, squirrels, flies, and bugs made eye diseases normal. Brightening the eyes with kohl was a defensive variable against eye sickness. The antiquated Egyptian doctor additionally frequently endorsed douches. There were strategies for forestalling pregnancy or expanding sexual strength, or the capacity to consider in ladies, and for treating torment in the lady's body. We got a letter that one of the Hittite rulers had shipped off the Pharaoh of Egypt, trusting that the Pharaoh would send him a doctor to treat his sister so she could have a youngster. In any case, the Pharaoh answered that the justification for his sister's fruitlessness was because of her advanced age and coming to menopause, and that no doctor could change this condition. We know presently that the old Egyptians knew about all illnesses and all pieces of the body. We find in certain mummies instances of removal, or fake appendages, made of wood, and even medicines of opening the cerebrum. The state of the treated bones because of a break or wound demonstrates that the individual treated lived for a long time subsequent to going through a medical procedure to treat him. The old Egyptian doctor concocted numerous clinical instruments and helps. These included surgical tools, blades, forceps, and utensils. Not many of them were found, however they are referenced in numerous compositions and in certain drawings. The gear of every doctor included little blades, a spoon for bombs, and a mortar for pounding drugs. A kite feather was utilized as a dropper to treat the eye. The bowel purge was additionally utilized for treatment. Among the remedial materials were incense, and an incense gadget that comprised of two compartments, one inside and the other outer. Different cutting apparatuses were utilized in careful activities. Medical procedure among the antiquated Egyptians was designated jua. A gadget called hymum was likewise utilized as a metal surgical blade that could be utilized to open an abscess. This surgical tool is referenced in clinical texts and is viewed as an exceptional clinical gadget for medical procedure. The Egyptian doctor utilized a blade called des, made of stone, and was utilized in everyday medical procedures. He utilized one more sort of blade called shas, with a particular shape that he used to treat cancers. He utilized the hino gadget, which comprises of cowhide and a kind of forceps or utensils. As referenced in clinical texts, the drill, ja, and the surgical blade, shibet. The shibet surgical blade was utilized to treat ear contaminations. Clinical Instrument Bureau. On the mast of the Kalmambo sanctuary from the Ptolemaic period, there is a board known as the Clinical Instrument Bureau. Archaeologists are as yet exploring how the Egyptian specialists involved every one of these apparatuses in various medicines. On the board, you can see scissors, forceps, a scale, a saw, drills, bits of loofah, packs, cups, and strips. The scissors were basically the same as the scissors in the Coptic Historical Center in Cairo, which were utilized by Coptic specialists to treat enormous injuries prior to stitching the injury. The scissors were additionally used to slice wraps to tie wounds and as gauzes. The sacks were generally used to store medications and drugs. Concerning the strips, they were utilized for scratching or cleaning bones and to apply medication. The gadget is viewed as a punch for puncturing the skull. To open the skull, the old Egyptian specialist would cut and eliminate a piece of the skull bone either by scratching or utilizing an etch. Head tasks were not referenced in antiquated Egyptian original copies, but rather contacted us through the Corpus Hippocraticum. Cerebrum tasks were additionally tracked down on living individuals from the earliest times of antiquated Egypt, from the New Realm and the late time frame, and this is all generally reported. Indications of recuperation demonstrate effective careful tasks. Helper devices. Each specialist had a few swathes. The Egyptians utilized for this reason different texture, length, and width of lines. The old Egyptians called veitet, which are plant strands among these wraps. This wrap was plunged in a remedial substance like honey, treatment, or oil, and the gauze was at times utilized dry. Plant filaments were likewise utilized as wraps. The compositions notice two kinds of strands, veitet and veitet indept, meaning veet from the dipped plant. It appears to be that the old Egyptian specialists knew an inhaler. There is a composition depicting how to make this gadget, which contained hot rocks, a restorative medication, and a head and a reed from the backwoods, and was utilized to treat hacks. Clinical papyri were likewise utilized as helps, as were clinical instruments, which were kept in calfskin packs. Rehearses. The Egyptians had some information on human life structures. For instance, in the traditional preservation process, mummies knew how to embed a long, bended instrument through the nostril, break the slight bone of the cerebrum, and eliminate the mind. They likewise had an overall thought of the presence of inner organs in the body depression. They eliminated the organs through a little entry point in the left thigh. Whether this information was given to professionals is obscure. Be that as it may, it doesn't appear to have had any impact on their clinical hypotheses. Egyptian doctors knew about the presence of the beat and its association with the heart. Indeed, even the creator of the Smith papyrus had a dubious thought of the heart framework. Despite the fact that he didn't know about the circulatory framework and considered it immaterial to recognize veins, ligaments, and nerves, they fostered their hypothesis of channels that conveyed air, water, and blood to the body by similarity with the Nile stream. Assuming it was obstructed, yields would become unfortunate. They applied this standard to the body. In the event that an individual was debilitated, they would utilize diuretics to open the channels. The earliest composed text that makes reference to bowel purges is the Ebers Papyrus, and many meds were given utilizing douches. Among the numerous clinical experts was Airy, the benefactor holy person of the butt. Large numbers of their clinical practices were viable, for example, the surgeries depicted in the Edwin Smith Papyrus. For the most part, specialists' guidance for remaining solid was to wash and shave the body, including under the arms, to forestall diseases. They additionally informed patients to take care regarding their eating routine, staying away from food sources, for example, crude fish or different creatures that were viewed as messy. Medical procedure. The most seasoned metal, bronze or copper, careful instruments on the planet were found in the burial chamber of Kar. Medical procedure was a typical practice among doctors as a therapy for actual wounds. Egyptian doctors perceived three classifications of wounds: treatable, questionable, and untreatable illnesses. The fact that surgeons would rapidly fix makes treatable ailments those. Easily proven wrong illnesses were those where the casualty could almost certainly make do without treatment, so patients who were thought to be in this class were noticed, and in the event that they made do, careful endeavors could be made to fix the issue with them. They utilized blades, snares, drills, forceps, pincers, scales, spoons, saws, and a consuming incense pot. Circumcision was a typical male practice, as referenced by Herodotus in his chronicles. Albeit seldom referenced as a methodology, the uncircumcised idea of different societies was habitually noted, and the Liberians were regularly alluded to, and military missions brought back uncircumcised penises as prizes, recommending curiosity. In any case, different records depict starts into strict orders as including circumcision, suggesting that the training was private as opposed to boundless. The main known portrayal of the strategy, in the burial place of the doctor, the entombment spot of Ankh-Mahar at Saqqara, shows teenagers or grown-ups, not youngsters. Female circumcision might have been polished, albeit the main reference to it in old texts might be a mistranslation. Prosthetics, like toes and eyeballs, were additionally utilized. Generally, they filled minimal more than ornamental needs. In anticipation of entombment, unaccounted for body pieces would be supplanted. Nonetheless, these don't seem to have been helpful, or even caused, before death. The broad utilization of medical procedure, embalmment practices, and post-mortem examination as a strict activity provided the Egyptians with an immense information on the morphology of the body, and, surprisingly, an incredible comprehension of the elements of organs. The elements of the greater part of the significant organs were accurately expected. For instance, Blood was accurately speculated to be a happening vehicle for imperativeness and waste not distant from its genuine job of conveying oxygen and eliminating carbon dioxide, except for the heart and cerebrum, whose capabilities were changed. Dentistry. Dentistry was a significant field, as a free calling, tracing all the way back to the mid-3rd thousand years BC, despite the fact that it was most likely never noticeable. The Egyptian eating routine was wealthy in abrasives from the sand left over from crushing grain and the stones with which bread was made, and their teeth were consequently in awful shape. Archaeologists have noticed a consistent decrease in the seriousness and extent of tooth wear from 4000 BC to 1000 promotion, presumably because of further developed grain-crushing strategies. All Egyptian remaining parts have sets of teeth in exceptionally unfortunate condition. Dental illness can be lethal, as in Jemmet Enk, a performer from Thebes, who passed on at about the age of 35 from broad dental sickness and a contaminated pimple. Assuming a singular's teeth endure the disintegration, rot was uncommon, because of the shortage of sugars. Dental treatment was ineffectual, and the best individuals who experienced it were the fast loss of an impacted tooth. Engshonk's guidelines contain the precept: "No tooth spoils and stays in its place." There are no records archiving the speed increase of this interaction, and no appropriate apparatuses for tooth extraction, albeit some remaining parts get defensive toward effectively got rid of. Stays of substitution teeth have been found, in spite of the fact that it isn't evident whether they were simply superficial in the afterlife. Serious torment might have been treated with opium. Sustenance. The old Egyptians were unquestionably somewhat mindful of the significance of diet, both in equilibrium and balance. Given Egypt's huge stockpile of rich land, food creation was not a significant issue, in spite of the fact that, regardless of the overflow of land, neediness starvation actually existed. The fundamental yields for the greater part of old Egyptian history were wheat and grain. A solitary rancher's yield could be consumed as portions delivered in different sorts through baking and maturation, with yeast extraordinarily enhancing the dietary benefit of the item, and a solitary rancher's harvest could uphold an expected 20 grown-ups. Grain was likewise utilized in lager. Vegetables and products of numerous sorts were generally developed. Oil was delivered from the linseed plant, and there was a restricted scope of flavors and spices. Meat, sheep, goats, pigs, and wild game was consistently accessible essentially to the high societies, and fish was generally consumed, in spite of the fact that there is proof that specific sorts of creature items were precluded during specific periods. Herodotus composed of the pig as Messi. Contributions to Lordunes, circa 2494 to 2345 BC, are recorded as milk, 3 sorts of brew, 5 sorts of wine, 10 portions, for breads, 10 cakes, for meats, different cuts, joints, cook's spleen, appendages, bosom, quail, goose, pigeon, figs, 10 different natural products, 3 sorts of corn, grain, wheat, 5 sorts of oil, and new plants. Obviously, the Egyptian eating regimen was not lacking among the privileged societies, and that even the lower classes might have had some decision. Pharmacology. In the same way as other civilizations before, the old Egyptians investigated finally the restorative properties of the vegetation around them. The Edwin Smith Papyrus contains various recipes to assist with treating different sicknesses. In a little part of this papyrus, there are 5 recipes, 1 managing issues that ladies could have, 3 on skin decontamination procedures, and the 5th recipe for illnesses managing the colon. The Egyptians were